Here we go. Here we go. All right. All right. Well, good morning, everyone. I am excited to see you guys all here today for our October UCCCN meeting. I'm both amazed that it's already October 20th, but I've also been trying to push past it. I've been so confused this month. I've been, thinking it's like a week from now too. So anyway, glad you guys know what day it is and that you're here. So let's go ahead and advance our slides. This is our agenda for today. We'll do our usual welcome and introductions. We like to take the time to do that so that for those who are new or for those who maybe haven't attended for a little while, we have the opportunity to get to know one another just a little bit, to find out what your role is and where you're located. A big part of the Utah Children's Care Coordination Network is the networking part. So this is your meeting, this is your group, and we want you to know who's in it. We're pretty relaxed about things. It was certainly easier to get to know one another when we were in person. But we have seen a lot of really positive things come from going virtual. And we're delighted that we have had so many people be able to join us on the Zoom. So we'll take that time to actually go around, and for those who are able, please actually unmute and tell us who you are. If you're comfortable turning your camera on, that's really wonderful too. Not necessary. And we love the Zoom chat feature. So that's a really nice thing as well. Please feel free to use that. So we'll go ahead and go through introductions. Then we talk about a few announcements and some updates to the medical home portal we want you to be aware of. We always take some time for cases, so that if you have any cases that you'd like to talk about, we can bring them before the group, do a little brainstorming, do a little crowd sourcing, see if we can help if you're running into any barriers. If you know of any new resources, this is a great place to let us know about those. We make sure that they get into the medical home portal so that they're captured. We love hearing about any motivational interviewing you're doing, any quality improvement you're working on. And we really enjoy hearing about updates to cases. So if you've brought one in the past and you want to let us know how things are going, that's really welcomed as well. So that's your time, and we hope you'll take advantage of it. Oh, and it looks like I failed to indicate what was happening for the main part of the meeting. And so today we are going to be doing a summary of the Transition to Adult Healthcare Summit that took place last week, the 3rd annual. And so we're excited to let you know what happened there if you weren't able to attend, and to also kind of talk with you about what we can take from it going forward. So again, very relaxed meeting, lots of discussion, we hope. And we'll wrap up by 10. All right, so welcome and introductions. My name is Mindy Tueller, and I am the Director of Operations for the Medical Home Portal, and I facilitate this meeting, the Utah Children's Care Coordination Network. We've been doing this now for 7 years, which is kind of crazy to think about, but really have enjoyed it so much. This is probably one of the favorite parts of my job that I get to do. And then what I'm going to do is just try and go through who I see on my screen in terms of your name, and I'll try and actually look in the chat as well, because I see. So
I'll start with myself. My name is Gabi Baragoshi. I am one of the UPIC QI coaches, and I know several of you. And so if you have any questions about quality improvement, please reach out to me. Okay, can we go to Tina? Do you want to introduce yourself?
Hi, I'm Tina Purcells. I'm with Utah Family Voices at the Utah Parent Center, and I assist families on that one-on-one basis, phone calls and contacts, and help them to navigate the systems, especially, looking at special healthcare needs.
All right, Gina, you want to go ahead and introduce yourself?
Hi, Gina Polamoney. I guess you guys just can't get rid of me. So I'm URLAN family faculty, as well as now on the editorial board of the Medical Home Portal.
Okay. Oh, hi, Mindy, you're back, unfrozen. You want to take over again?
I didn't realize. I just thought you were you're doing a great job. I'm going to let you go. You go, Gabby. She's not going. I'm going. Okay, I'm going. Yeah, we're delighted to see you, Gina. I'm always happy to have you here. Okay, so the next I see is Michelle. Michelle, do you want to introduce yourself?
Sure. Hi, I'm Michelle Redfield. I'm the administrative assistant for Medical Home Portal and UCCCN.
Happy to have you here, always. Okay, Pat Rowe. See if Pat's able to unmute. She may not be able to. So Pat is a care manager at Select Health. She was actually part of the summit last week. So we're really pleased to have her here on the call as well. And hopefully she'll be able to talk at some point. But Pat's a firecracker if you don't know her, and we love to have her on. All right, Eric.
Good morning. I'm Eric Christensen. I'm the program manager with Utah Department of Health Integrated Services Program.
Great. Love to have you here, Eric. You're such a big part of this meeting and this group. Athena.
Hi, I'm Athena Parker, and I am also with the Medical Home Portal as the support services manager. I work with all of our state partners and the Utah directory.
Glad you're here. Athena's just about to take off for a couple of weeks vacation, a little bit of a working vacation, but yeah, we're happy that she was able to join us for a little bit this morning. All right, Laurel.
I'm Laurel Bishop. I'm a UR-Land parent trainee, and I'm down in Genola, Utah, so now you can check your geography.
We'll do it. Glad you're here. Yvette.
Hi, my name is Yvette. I am a patient care manager here at the University General Pediatrics Clinic.
We're glad you could join us this morning, Yvette. I know you're really busy. All right, Christina. Oh, I probably have that wrong. Sorry. All right, well, let me keep going down. Jill.
Good morning. I'm Jill Connor, Director of Business Development at Shriners Hospitals for Children, and we will soon be changing our name to Shriners Children's Salt Lake City. So I'll give you more details when we have our recaps.
Great, great. Yes, we want to stay on top of that. Glad you're here, Jill. All right, Nicole.
Hi, I'm a DNP student as a UR-Land trainee this year.
We are glad you could join us this morning. All right, I see someone who's showing up as E. Wall. I'm not sure what oh, is it Erica?
Yes, sorry, this is Erica Wall. I'm just over the CSHCN with Tri-County Health Department.
We're glad that you could be with us today. Welcome, welcome. All right, Heidi.
Hi, I'm Heidi Bates. I'm with UPIC. Yeah, and just so you know, there's still time to sign up for our asthma collaborative.
Okay, you're welcome to tell us more about that as we get into the announcements too, if people want to be reminded.
Perfect, thanks.
Okay, great. Let's see, Jade.
Hi, I'm Jade with University Health Plans and Healthy Medicaid Care Management.
Glad you could join us for a little bit. Your background was really cool. That's gorgeous. I want to be there. Very nice. Okay. Next we have Alexa. And let me just double check if you've put something in the chat. Some folks have done that. Yes, Alexa is a new social worker for outpatient cardiology at Primary Children's Hospital. Well, Alexa, welcome. We're really pleased that you could be with us today. And we hope that if you're able, you'll join in via chat or however you're able. All right. And I see Alicia Mather has put her information in the chat as well. Nurse care manager with Memorial Pediatrics. We're so glad you could be with us. Thanks for helping me pronounce your name. I really appreciate that. All right. Steve Smith.
Good morning. I'm Steve Smith, and I'm excuse me. I'm with the URLM program. I'm a PhD student at USU.
Great. Steve, what's your PhD in?
It's going to be in disability studies.
Oh, fantastic. Well, we love USU. We've worked with well, I can't tell you what the new institute name is. But
it's the Institute for Disability Research, Policy, and Practice. I also have worked with for them for 8 years.
Oh my gosh, that's great. Well, CPD is a lot easier for me to get out. So, but welcome.
It was.
Really glad you're here. All right, James Moore. Are you able to unmute and tell us? I'm not seeing anything for James in the chat. So, James, if you're able to let us know at some point who you are, we would love to know. All right, Nikki. Nikki is the care coordinator at Busy Bee Pediatrics up north, and we always like it when Nikki's able to join us. So welcome. And how about Tony? Tony has put her information in the chat. She's a care coordinator with the Integrated Services Program with Eric's team. She was also part of the summit last week, so happy that she's on today. Tony is located in the Ogden area. Glad you're with us, Tony. All right, and Natalie, are you able to unmute, Natalie?
Yes, good morning. I am the nurse practitioner with Integrated Services Program, and I also teach at the University of Utah in the nurse practitioner program.
Natalie is also someone from the summit, so we're pleased that she was able to join us today. How about Janet? Janet has put her information in the chat. I see that. So Janet is a care coordinator from Southwest Children's Clinic. Wonderful. Janet, if you're able to let us know, is Ileana on today with you, or are you guys separate?
She is on vacation. She doesn't come back till tomorrow.
Oh, wow. Well, good for her.
Yeah.
That's wonderful. All right. Well, we're glad you're with us. Wonderful.
Thank you.
All right. Rebecca.
Hi, I'm a care manager at the University of Utah Farmington Clinic.
Fantastic. Glad you're with us. Okay. And Dawn Galloway. Maybe Dawn has put her information.
She is in the chat.
Okay.
And she is a care manager with Budge and Northern Utah Peds in Logan and Ogden.
Excellent. We love it when the folks from the northern part of Utah can join us. So glad you're with us, Dawn. All right, and Gwen Anderson.
Hi, I'm here. Thanks for having me always. I am part of Eric's integrated service team. I cover Carbon, Emory, and Grand counties.
We're pleased you're here too, Gwen.
Thank you.
And I see someone who's on Zoom as A. Merrill, M-A-R-R-E-L-L. Let's see.
Hi.
Hi.
Yep. My name's Allison Morelli. I'm an LCSW pediatric ambulatory care manager at Castell.
Wow. All right. Well, thank you for joining us. Wonderful.
Thank you.
All right. Carly Allen. I met Carly last week. Hi, Carly. Are you able to unmute?
Hi. Yes, I'm the adolescent and young adult patient navigator and program coordinator at Huntsman Cancer Institute.
That's right. Well, we're really pleased you can join us. Terrific.
Thanks.
All right. And Evelyn. If you put your information in the chat. Okay. Evelyn is the care coordinator at Utah Valley Pediatrics in the Cherry Tree office. That's right. Perfect. We're so glad you're here. I'm going to look at the chat and see that James Moore is the care manager from Northern Utah Peds in Layton. Glad you're with us, James. Fantastic. All right. Trying to manage the chat as well as the thumbnails over here. I think we're getting there.
We have Danny Ramstack, heart transplant coordinator at Primary Children's Hospital.
Wonderful. Hi, Danny.
Let's see, we also have Katrina. She's got a dial-in number. She's the Intermountain Project Manager of Pediatrics Community-Based Care.
I saw Katrina's face too, so I know she's on 2 ways, or she was. Hi, Katrina. Great. And then I see Elissa is an outpatient social worker at Primary Children's Hospital. Excellent. Okay. Oh, my audio is cutting in and out. Bummer. All right, I'll see what I can do about that, guys. And who have we missed? We have a telephone number that looks like it's from Intermountain, and that very well may be somebody who's already introduced themselves. I see.
Yeah, I think that's Katrina.
Okay, that's Katrina.
The 718.
Nope, it's a 662-1000.
Oh.
And that's okay. My guess is it's somebody who's already piped in. So, and Angie, we're glad you're with us, Angie. Are you able to unmute?
Yeah, I think so. Can you hear me okay? Okay, great. I'm Angie Richens. I'm the Director of Behavioral Health and Care Management for the Alpine Pediatrics Group in Utah County.
We are really pleased you can join us. Thanks. All right, looking quickly through the chat. I think we got everyone. Oh, Dr. Goldman-Luthi. Jennifer, are you able to unmute, or do you want me to introduce you?
Hi, I'm Jennifer Goldman-Luthi. I'm a pediatrician at the U, and I work with Mindy in the medical home portal.
Right, fantastic. Well, welcome everybody. We have some new folks on the call, so we're really pleased about that. And as I mentioned before, we're pretty relaxed around here. So we really love interaction, and that chat feature really helps to make that possible if you're more comfortable with that. But you can also unmute and go ahead and participate. We'd love to hear from you. All right, so if you're able to join on the computer with Zoom, that seems to be the most rich experience. So we'd encourage that. We do want to, be conscious of your time. So we will end promptly by 10. Did I skip a slide? Nope, we're good. Okay. And a couple of announcements. We wanted to let you know that the Pfizer COVID-19 booster shot for eligible individuals, including youth with special health care needs, is available today at the Utah Parent Center this afternoon from 2 to 5, and no appointment is needed. I sent out an email about that yesterday. Tina, do you want to say anything more about that?
Yeah, I'm sorry, it wasn't on my radar to get this to everyone sooner. We do have the ability to be a little more disability friendly at the Parent Center, because of our knowledge, first of all, but secondly, we've got, some offices set aside if someone might be having a meltdown, or, there's a little extras that we've added around the office to be able to just accommodate people in situations. With that being said, there will be more clinics coming up, and I will let you know sooner. But that it is today from 2 to 5. You can just drop in if you want to get your booster there. I know it's pretty simple to get it most places. We are just a little more able to accommodate. You're not standing in front of a pharmacy at Walgreens or something to have it done, and your kid drops into a meltdown. So I will be taking my child there this afternoon, as a matter of fact.
That's excellent. Very good. Okay. Thanks for that information. All right. And then we always want to make you aware of the Pediatric Project Echo that is going on. We've talked about this before. We're actually partnering with the Project Scope Echo series out of USU that's about opioid exposure in infants. And your cases are actually really wanted if you have any that you think might be a NOWS or a NAS case. They would love to have you present on that. Or somebody else can present if you'd prefer. But if you've got one of those, please let us know. We'll make sure that registration link is available. There's several more of those coming up. So here's the dates and the some of the topics. Anyway, some of these are already have already passed, but the recordings are available. So that's been really, really neat. I think a lot of the information that's come out of these is very relevant to this group. So consider taking a look at one of those recordings if you're thinking that you need some help in one of those areas. And then on November 3rd, we're actually having someone from within the Department of Pediatrics at the U do an echo session. So kind of in the middle of all of these others as well. And she'll be presenting on breastfeeding babies with special healthcare needs and breastfeeding tips at large. Jennifer, do you want to say anything about that?
Well, what I would like to say is that the two people who are speaking are really knowledgeable, and one is our lactation nurse and the other does a lot of lactation training for different communities. And they're both wonderful, wonderful people. And I think that they'll share lots of interesting information and tips. I don't think it's all going to be just like how to, but more about how to take care of these kids from a medical perspective. So I'd expect more on less on the mechanics of like latching and so forth, and more on what do you do when this child has a special need, like a cleft or something along those lines. So I think it'll be useful for care coordinators to hear about some of the ways that they might work around different situations to help provide support.
Very nice. And those are on Wednesdays at noon. And if your Wednesdays are like my Wednesdays, you're already pretty loaded. So we get that. But if you're able to join, there is CME available. And we are anticipating being able to do nurse contact hours coming up here as well. So just let me know if you have more questions. And in the summary that we send out, there'll be more information on that. All right, clearly I've had a busy week because that's an empty slide, but this one is the one that we want to remind you of every meeting, that the Spark Autism study is underway at the University of Utah. It's one of the locations for this very big study, the largest study of autism ever. And there are a lot of nice things that are happening with that. Free, really easy, done through the mail. It's intended to look at genetic causes. So it's asking for parents and siblings of those individuals who have been identified with autism. And if you have more information, there are folks who would love to help provide you with things that can help you connect with patients who might want to join this, getting the word out, all that kind of stuff.
Hey, Mindy, I've got a question on that. It's kind of weird and personal as usual, but so we did receive our kits, and Steve and I have no problem spitting in a tube. But then we have Adam, who will not let anything near his mouth. He's got sensory issues. He will not. He will not.
Yeah.
So is it even, I did email the person that sent us the stuff, and they said, well, just try your best. And our best is, a fight. It's not going to happen. So is it even helpful to have just the parents, or do they really, really have to have the child? Do we know?
It's an excellent question.
Yeah, Mindy. So this is Heidi, and Gabby's on too. And we are part of the study as well. We're the research study coordinators. So you can actually, we will send you a swab. So you swab their mouth.
Oh, I would love that so much.
Yeah, but so yeah, we really need their DNA.
So, but yes, force a swab. I just can't force him to give us that much.
Absolutely. I'm the same boat with my son. We can't get him to, I mean, he'll spit, just not on demand. Do you know what I mean? Like, he'll spit everywhere else, just not in a tube. Yeah. So yeah, no, yeah. We are, and just so you know, as far as I understand, they are the Spark Central, they are behind they're running low, back ordered on swab kits. But I will get your information, and we will send you a swab kit.
Heidi, I'll put it in the chat for you.
You're fantastic.
I don't think anybody knows where I live. Thank you. And I would expect that they are going to be, because I'm seeing this all over I see commercials about it now.
Good. And
that's what we want. I bet you're going to be backlogged on swab kits, because so common. And it's not like I'm going to force him, but I can at least, like hold him for a minute and get the swab really quick versus here's the container to spit in. So I'm so happy to know that you have that now.
Yes, absolutely. Yep. Thank you. And you can also email me as well, your information, or we can connect later. No worries.
Sounds good. Thank you.
Okay. Thanks, Tina.
Yeah, great question, Tina, and we really appreciate it. I mean, I think that's one of the things that we learn in this group is that those personal experiences are often very valuable for others if we're willing to share them. And Tina's very willing to share, so we appreciate that so much. All right. So wanted to let you know about some updates to content on the Medical Home Portal. We have updated the newborn disorder on classic homocystinuria. Say that fast, 12 times. We've updated our diagnosis module on foster care. We have made some updates to a couple of transition pages. Imagine that. And we'll probably show those and mention those in a little bit. And our care notebook has been updated. We're so pleased about this. I think we've been teasing you a little bit about this for a few months. The care notebook is actually probably one of the most used resources on the Medical Home Portal. It is literally a downloadable notebook that parents and families can use to help keep track of what's going on with their child. It's something that's probably near and dear to Gina's heart. She was involved with that origin years and years and years ago. And so we're really grateful to the Utah Parent Center and Utah Family Voices for their help in getting that more updated. And then to Michelle for helping make that very user-friendly. So it's a now fillable PDF. And it's a big notebook if you want to download the whole thing, but you can also just download individual pages of it. So we hope you'll check that out. All right, Athena, do you want to take over or let's see, I might have to let you see how I do this. Athena can do it. Wow, she's good. All right.
All right. I know with the Transition Summit, I thought I'd just highlight a few of our transition categories and ways you might find service providers that offer transition services, and then also show you a little bit about some of the updates that Mindy mentioned for Utah specifically. So I'm here in the Utah Services Directory, and there's a couple of ways, again, you can search this. I personally think the search categories offer the most rich information. So if I just type in the word transition here, you're going to see I have these are the options, our current options of categories that specifically target transition services. So we have adolescent health transition programs, and then adult day programs, independent living arrangements and skills, social recreational opportunities, and supportive housing and recreational care homes. So if you're looking for something outside of that, you can also do a term search for transition, and that's going to bring up any listing that has the word transition in it. So you might see, you might have to do a little bit more searching here, but you will find some different kinds of services. So Alpine Transition Education Centers is a good example, student transition services. But then you'll see other things like transitional storage program. So, just be aware that anytime you do a term search, it's going to pull from anywhere in the listing for that word. So you might get a range of things, but you can also, again, use our map feature here to zoom in on any area in particular that you may be interested in and look at, in particular what's there. So here's one, for example, in Provo that's listed, or up here in American Fork, there's another one. So, and as always, we love your guys' input. If we have information in here that's incorrect or needs updating, you can use these great little buttons, the feedback button here, or suggest new provider. We always love to see new providers added as well. And then within the content of the Medical Home Portal, I'm here on the physicians and professionals page. And at the bottom, you'll see we have a whole section on transition issues. So click in here. It's divided up into a few different sections: birth to school, transitions, hospital home, and then transitions to adult. And within this section, you'll see we have this great new toolkit that's been put together through lots of work from Eric's team, especially the Utah Provider Healthcare Transition Toolkit, which is available here. And there's lots of other, again, great resources and links to finding all kinds of information about transition.
Excellent. Thank you very much, Athena. Appreciate that. I think I need to share again. All right. Hopefully you're seeing my screen again. All right. Well, we went over time just a little bit, but guess what? I control the meeting today, so I get to do what I want. So this is your time now, your brainstorming time, and we won't skimp on it. If folks have anything they want to talk about, we would love to hear from you. And so again, if you're able to unmute and talk, that's great. Otherwise, if the chat works, we'll be watching it.
Mindy, before we jump into some possible cases, can I just put a plug in again, like I try to every month, just to let folks know? I know we have some new people on the call today. Integrated Services Program received a grant late last fall to be able to put Chromebooks and hotspots in 4 of our local health departments. We have some at the Utah Parent Center and some also at our offices in Ogden. And those Chromebooks and hotspots are available to loan to families of children with special healthcare needs so they can conduct telehealth visits, assessments, evaluations with early intervention, with school, with service providers in the community. So if anyone knows of a family who might be able to benefit from having access to slightly newer technology to be able to conduct a telehealth visit, please reach out to us at Integrated Services. I'll put our contact information in the chat, and then, you know, Mindy's team is always great to forward that on again when the minutes for the meeting come out. But please feel free to reach out to us. We're happy to loan those out for an extended period to help families connect with support services and specialists in across the state.
Thank you, Eric. Yeah, yesterday had a different meeting with some of the medical home portal partners, and we partner with New Mexico, and they reminded us that having the ability to get onto the internet is a challenge for lots of folks in New Mexico, and I think we forget that sometimes. So really appreciate what ISP is doing to make that easier. All right, anybody else?
Hi, Mindy, this is Jill from Shriners. Also related to resources, I just wanted to address some recent changes that Shriners Salt Lake City has experienced. Our healthcare system, we are part of a larger 22 hospital system across the United States. And the Shriners have been responding to changes in healthcare and our community needs. And as such, locally, the Salt Lake City location, we have expanded our longtime relationship with Primary Children's, and we've transitioned our surgical services over to primary. So our patients will now receive surgical inpatient and infusion therapy service at primaries. They're just a mile away from us. The Shriners physicians and orthopedic surgeons will still perform the surgery. The only change is the location of their surgery. So to put this into perspective, about 1 in 10 of our patients at our Salt Lake facility are in need of surgery. All other services are on site and will remain on site at Shriners, Salt Lake City. This change transitions us from a hospital to an outpatient facility. So as I mentioned at the beginning of the call, we will be formally changing our name from Shriners Hospitals for Children to Shriners Children's Salt Lake City. The referral process remains the same. So, you know, really from a referring provider perspective, care coordinator perspective, nothing changes. It's just that transition of surgical services. And this is going to really allow us to focus on our unique service lines that we offer the community. And that includes our prosthetics and orthotics department, our wheelchair and seating department, our motion analysis center, multi-specialty clinics, which includes clubfoot, cerebral palsy, fracture care, and then our robust therapy services department. So please feel free to reach out to me if you guys have any questions related to this transition, but we are excited about it and excited to maintain our presence in the community and serving children with orthopedic needs. I know there's been we've heard more rumors about our closure, and I just wanted to make sure that that is far from the truth. So we're still thriving and serving patients.
Thanks, Jill. And yeah, we love our relationship with Shriners. So we'll do everything we can to help make sure people have the accurate information. We do have a lot of information on Shriner services in the Medical Home Portal's Utah Services Directory. So feel comfortable going there. We work really hard to keep that up to date. And yeah, maybe someday, Jill, will even be able to come back and go through Shriners again. We've done tours in the past with Shriners that were just amazing. So
yes, we would love that. Thank you for your support, Mindy.
Oh, you bet. All right, anyone else?
Hi, Mindy, it's Tony Estrada with Integrated Services Program. I just wanted to ask if anybody knows of any ABA services in the Vernal area.
Hi, Tony, this is Tina. I actually have had some struggles lately finding ABA in some rural areas as well. There is a link, I'm going to put it in the chat. It's provided by UCCCN Department of Health. And this is, from what I know, the biggest list of ABA providers out there. That's why I use it constantly. It is it's put together by Colin. What's his last name, Eric? Colin.
It's Kingsbury. I have that list, but yeah, it would be good to share with everybody else.
So
I just wanted to know if anybody had any recent, you know, if anybody's really reached out to anybody that provides ABA services.
So what I've been telling families is some of these, you know, it does give locations served here, but if they can find the ones that are closest to those locations and see if they have hired anybody in their area. I know that's a far stretch, but that's one of the suggestions I'm giving parents right now, because sometimes they'll be looking for a vernal consultant and then they find them and this list doesn't get updated sometimes. But this is the list here. It's in the
sorry, this is Erica. Hey, Tony, I do have a place called Learning Solutions here in Vernal. I've just learned of since I took this job. They do offer ABA therapies. And they're not in any list because they've only been open since May of this year.
Awesome.
Awesome. Thank you.
Nice.
I can email you that phone number and address and everything.
Perfect. Thank you.
And Erica, that's very helpful too. We will send that on to Colin Kingsbury so he can update his list. He's always eager to add new service providers to that list. So thank you.
I don't think they take, so I spoke to, I believe her name is Gentry. Gentry Jensen, yes, is her name. And she said they're in the process of getting, you know, through the process of accepting a bunch of different insurances. I don't know that they're on the Medicaid list yet, but she said they are actively trying to do that. So.
Awesome.
And Erica, yeah, we'd love to get that information as well. So we'll follow up with you. Get it.
I'll put it in the chat as well if that works.
Thank you.
Sorry, I'm butting in on you, Mindy. Does anybody know of one in Price by any chance? Or in that area?
This is Gwen covering Price area for Eric's program. And that has been a challenge for us, especially since Kids on the Move has now withdrawn. They can't find a provider down here.
Okay.
So, for Carbon, Emory, and Grand, they were formerly covered by Kids on the Move. And I think the Joseph Dixon is the same person that Erica just mentioned with behavior and learning strategies. And he's been one that I have talked to, and he's willing to do it also, but it's more of a virtual setting. And that's it. We, some of our families just received letters from Kids on the Move saying they can't find anybody to fill those positions. So if anybody else has any, we're trying to scramble to find, ABA providers for kids down here too, but we have referred to Joseph Dixon's, but I don't know any family that has enrolled and had visits yet, so I can't say how that works.
Thank you.
Thanks so much. Clearly a need. Oh, great. Thank you, Erica, for putting that information in. Great. Okay. All right, anybody else?
I have a question. I'm not sure if it applies like right here, but so we have a patient that's a 3-year-old that we are trying to get an evaluation done at UDAC, and they have a strict mask policy. And this child has like severe sensory issues, and so will not keep the mask on, and so they won't see her. Does anybody know of anything else that we can do?
Rebecca, are they requiring a face-to-face visit for the evaluation? Are they not able to do like a tele evaluation for the family for the autism piece?
I'm not sure, but yeah, I just don't, I think she's 3 and the mask policy is 3 and over, and they won't budge on it. So I could ask if, I don't know if they've done a virtual or not.
I would just verify. Sometimes parents state a preference that they'd like to do something live versus virtual. So I would just follow up with UDAC. They do a lot of things at UDAC through telehealth. I'm just not sure, if they're able, or if they're doing the autism evaluation that way. My guess would be yes, though, because they've been rather ingenious at the university at UDAC with coming up with ways to try to facilitate telehealth visits.
Is the family from Salt Lake Valley, or are they coming from an outside?
I think my clinic's in Davis County, so.
Okay. From my experience, they've done telehealth, so that should be an option. Usually it's when we have families coming from like Vernal or Wyoming where they have to have in-person visits. But outside from that, I don't think virtual should be an issue for them.
Okay, so the issue is the 3-year-old won't stay in front of the screen long enough to be evaluated. So
then that probably is where they're looking at trying to have the live visit. It's a bit of a conundrum. Were they able to offer you any other solutions other
no,
than saying
they will not budge?
Just you got to have a mask? Is
yeah.
That okay?
So that, and then I had a physician ask me yesterday for a 9-year-old with Tourette's that has like a verbal tic. What treatments do they offer for that? He doesn't want to use medication on someone that young. So he was wondering, like, would you do speech therapy, or where would you go to help him with that? It's mostly when he's speaking in public, he kind of has like a, I don't know, he kind of like grunts, I guess. Does anybody have any ideas?
We have information on Tourette syndrome on the medical home portal, and we have, let's get down to our services area. Tourette syndrome programs. Now, is Dr. Goldman-Luthi still on the line?
Yeah, this is always a tricky one because the majority of the time we just recommend wait and see because they can wax and wane and go away, and ignoring them is probably the best and easiest thing to do. But there are, as far as there's some behavioral therapy that you can do. It tends to be fairly labor intensive and not have perfect outcomes. So that's how come we don't usually strongly recommend behavioral therapy. But that's an option. Medications also have some limited utility. They can be beneficial in some people, in others not at all. And of course they can have side effects. So it's complex.
Yeah, he was saying that most of them are stimulants, and he's already kind of like hyper a little, and so he's like, I don't know if I want to add that too. So I don't know. So So just kind of like wait it out and let it be. That's kind of the instruction.
That's often the least invasive option for people. If the tic is causing the child a lot of distress, then behavioral health might be appropriate, or considering medications. But if it's just annoying the family, they can probably move on.
Okay, great. So behavioral therapy, like just through a normal like LCSW?
I think you want to look for somebody who is familiar with treatment of tics. There's a name for the therapy I've heard that I can't quite remember what it is, and I'm not seeing it in the portal.
Okay.
I'll
Athena,
keep looking.
are you still on?
I thought Tina posted something.
I'm still here. I'm looking as well, but I'll see.
Yeah, if you guys get any ideas, you can always email me, so that's fine too.
Okay, we'll keep digging on this one. That's really interesting.
Great. Thank you so much.
Very interesting. All right. Well, now we are pretty over time. So if it's all right, I think we'll move on to the next part of our meeting, but that was really interesting. Thank you, everyone. And of course, we put together a list of all of the resources that were identified during this time, and we'll send those out with the meeting summary. All right, so last Wednesday, the 3rd annual Teen to Adult Healthcare Transition Summit was held. It was at the Doty Education Center at the Intermountain facility in Murray, as well as online in a virtual setting. And so we had some people in person and then many people online, and it was really cool. And I'm happy that Stephanie Sund is here and able to join us. So Stephanie is the heart and mind and brains and brawn behind pretty much all of that. And we got great news during that meeting that some funding has been identified to maybe get some help so she can focus on more of the clinical stuff and less of some of the operational stuff. So she's been doing quite a bit in conjunction with Eric's group as well. And so we just love to kind of wrap up what was said there. I know from the attendee list that some of you were able to attend, and that's great. I got to see some of you in person. It was wonderful to see some of you because I haven't seen any of you for a long, long time. And then I know that a few others were able to attend virtually, but for those of you who weren't, we want to kind of let you know what was said. And so this was the agenda. And I hope that Eric and Stephanie will unmute and join in as we talk a little bit about how the meeting went and what went on in the panels. So please. So yeah, Dr. Giardino, who is the chair of the Department of Pediatrics at the University of Utah, and you can see he's got a lot of letters behind his name. He's just an advocate and a proponent for youth, and he's fantastic. So he's been a huge supporter of this whole project and everything that's going on. So he spoke first, and he had some terrific imagery that he provided. He wanted to talk about the transition train. So he wasn't sure that this is the right image, but maybe for now, this is kind of where we're at on the transition train. It's a little bit slower, but we don't want that to be that way for too long. And we want everyone to get on that transition train. And it was interesting. One of the things that I've noticed recently as I've been part of all of this stuff is an acronym, HCT, and I think I need to get that in my brain. It's healthcare transition, and it's used a lot in the literature and the processes and so forth. And Dr. Giardino expressed that means planning and transfer, but definitely integration as well. So we really need to make sure that all 3 of those steps happen as we transition youth into adult health care, so that loop gets closed. And he felt very strongly that care coordination can be a huge part of this. He also used the term transitionology and wants us all to become transitionologists. So put that in your vocabulary now. Talked about the numbers of children who are getting support for transitioning to adult health care. And it's it's right in the neighborhood of 18 to 19% of youth with special health care needs per a national children's study a few years ago now. It should be more, of course, we get that, we know that, and there is evidence that there are positive outcomes when there's a structured process that helps with that. And of course, that makes perfect sense to all of us.
And Mindy, can I just interject here as well? So Dr. Giardino used the 2017-2018 combined data set from the National Survey of Children's Health, which asks families to report when they have a youth with special health care needs, the percentage who are receiving services necessary for medical transition. The numbers from the next year survey, which is actually 18-19, was much different than the 17-18 year. We had, I want to say, roughly around 11+% of children with special health care needs or youth with special health care needs reported that they were receiving services necessary. So a big difference between 17 to 18% and only 11+%. Even more dismal were youth without special health care needs, and that came in somewhere around 10.4, 10.5% of those families felt like their family and their youth received those services necessary. So I emphasize that because it just indicates that statewide, and those are Utah numbers, by the way, indicate that statewide we have a lot of work, but it's also a unique challenge and a great opportunity for us to systemically create and implement something that is a no wrong door approach. So for any family who has youth and they need help transitioning to adult medicine, over the next several years, we will be in a terrific position to help those families make that transition much more smoothly.
Thanks, Eric, for clarifying. Appreciate that. I need to look at the resource that Dr. Giardino mentioned from CHOP, and I believe that Children's Hospital of Philadelphia is where he did some of his training. So he has a direct line into there, and he showed some slides. They were really interesting, and one was this complex web of communication that was trying to show. It was a little bit like the care map that we've seen before for children. This is what needs to happen to help youth with complex issues transition to adult healthcare, and it was something. And of course, we also understand that once it's no longer they're eligible for certain services or not, then there's that cliff that can happen, and that can be a huge change for young people and their families. So some very interesting images that he shared. And Stephanie, that presentation was recorded, is that correct?
I'm actually not sure. I need to verify if it was recorded. I don't know if it was.
It might be. I might like to try and grab a copy of those slides, or at least ask for some of those references.
Yeah, I can get you the slides. Absolutely.
Okay, I think that would be helpful. There were some really interesting things that he referenced that sort of drove the point home, for sure. And then he talked about the new provider healthcare transition toolkit. And Stephanie, that's your baby. So do you want to mention a little bit about that, and I'll go and show it?
Yeah. So I've been working on this toolkit since the end of 2019, and this end of 2020, I had a master's student who's getting her nurse practitioner. She took over, and this kind of became her baby. So the toolkit is based on Got Transitions model, and a few of the tools have been taken directly from there. Some of the tools are things that we have created that we feel like we're missing. And so it's kind of a large toolkit, but the main things we want people to work on and focus on from the toolkit are things like a readiness assessment. So being able to tell how ready this kid is to transition. Are they able to do A, B, C, and D? And it really helps start the conversation with the family and and the patient to be working together on some of these skills at home. So that, and then there's a big piece on patient education. So there's quite a few documents in here. And what Mindy's showing you is the table of contents. And I believe when you hover over it, you can click on any one of them and it will take you to that direct document. So that is really awesome because then you don't have to go through the whole document. But there is a lot of information for patient education. So things like learning the differences between adult care and pediatric care, knowing how to prepare for your first appointment, knowing about insurance and funding, knowing how to speak up for yourself and advocate, knowing how to use My Chart and My Health, having a portable medical summary, those kind of things. And the documents are created, there's one on guardianship, there's one on advanced directives. And I know there's a lot of information about guardianship and those kind of things that, like from the Utah Parent Center, for instance. This document has taken some of that information and just made it a little bit more simpler. It's at a pretty low reading level to try to help parents kind of understand the basic concepts. It does talk about supported decision making as well, and trying to learn what that is and talking with your teen about supported decision making and what that looks like in their life. And then the last thing we want people to focus on, so you've got your assessment, you've got your education, and then is a plan of care. So, you know, most people do a plan of care, but just creating, you know, one simple goal related to transition, you know, that like, so the readiness assessments are done yearly generally. So let's say Johnny, he would have a year to say, okay, this year I want to work on learning how to refill my prescriptions and learning how to make a doctor's appointment or something like that. And so that would just be part of his plan of care. And then you would, you know, help him break down that goal and how he's going to accomplish it and what kind of barriers he might come across and those kind of things. So that's the big stuff that's in the toolkit. There's other things like a transfer of care letter, a transfer of care checklist, some of the things that are directly from GOT transition, like I mentioned. Yeah, we've had quite a few people working on it. Eric and his team have looked at it. We've had a lot of people from Primary Children's look at it, people from Intermountain Pediatrics. Yeah, so it's finally ready and it's out for use. And so it's not set in stone though. So as you're using it and looking at it, if you find things that you think shouldn't be in there or something that is missing, if you'll please let me know. We're gonna do revisions about every 4 to 6 months on it. So we're just waiting. It's been out for about a month and a half so far. So we're just gonna wait till towards the end of the year and then get feedback from people and then update as we need. And then from that first update, then we'll start translating it into Spanish. Some of the documents are already in Spanish from GOT Transition, but the ones that we've created are not. But I just don't want to translate them yet until we know that they're really good to go and people have used them, because no one's used them so far. So yeah, I don't know. What else should I tell them about the toolkit, Eric? Did I miss anything?
No, I think that was really, really thorough. We want providers to feel empowered and feel like they can jump in at any point and get started providing or having their office work with youth on transition. When you look at kind of theoretically how they, meaning the national people at GOT Transition, recommend an office does it, you get a policy and a steering committee and, you know, a whole bunch of stuff on the front end. We feel like those folks can hop in and get started trying to work with their youth once they establish a policy. And there's a sample policy in here that any practice can utilize. Once they have a policy in place, we feel like most practices can jump in and start working with their transition age youth on this, and then worry about some of the other details in the background as you get going. So, you know, how do you track everybody? What is your, you know, do you have an office steering committee? Some of those other parts and pieces can take place while you're actively trying to work with families. And the other part we want to point out is that there's a lot of help out there, a lot of reinforcements to help you work with your families as well. And that's probably something we'll cover in just a few minutes when we discuss, a couple of the other panels that were at the summit.
Great. Yeah, we have a little bit more to cover, and then we can dive into some of those things. Thanks, Eric. So, right. So the toolkit actually is being piloted right now, right, Stephanie?
Yes. Yeah, I forgot to mention that. It's being piloted by 8 clinics, 7 are which are primary children's subspecialty clinics, and 1 is Wasatch Pediatrics, which we are super happy about. We only have 1 community clinic so far, but that's only because that's kind of just where we've gotten. Doesn't mean we don't want more. But we're just trying to get people to actually pilot it and give us that feedback, really help operationalize it. And so I have, for each of those clinics, I have a transition champion and someone who is the direct connection between me and the staff at the clinic, and obviously the families and parents. So, yeah.
Okay, so know that you could pilot this for Stephanie too.
Yes, absolutely. You can use it and not be considered a pilot clinic, but if you do want to be considered a pilot clinic and you really want to kind of dive into it and kind of work with us on improving it, then absolutely let me know. But it's still open for anyone to use, for sure.
Yeah, of course, right.
And Stephanie, I don't know if it's if you want to talk to Amy Hurst, but they just put out their new transition book for the Parent Center, which is more, it's not as health related as this one. This one is fabulous, by the way. And it's yours is a lot more. So I was just wondering because they don't really focus on health in Transition University. And that's really, I feel is really missing, because it's one of the biggest pieces, at least what is for us. And so if you could see if they want to partner and also pilot that through I think they've got Transition University coming up again on November 3rd. I'll look and make sure I put it in the chat when it's coming up. But just a thought there.
Yeah, I definitely could. I've worked with Amy a little bit just with the summit and attending some of her Transition University meetings. And so she did have me look at the healthcare section. And I definitely think I'll reach out to her again and see what else we can add to it or kind of polish up for the healthcare transition side.
Well, and I don't know if we need to polish anything up or anything else, as we can, I have to look at it. I haven't looked at their book yet, to be honest. I just saw it the morning of the summit. But yeah, I don't think we need to reinvent any wheels I just think we need to hand it out. I think this one's great, as long as we're making sure, like, I love that you had my chart and my health in there, because that is a big issue in transition right now for us. So yeah, I'm not sure how much they need to polish up. I'll take a look at it too.
And one thought about Transition University, because it is all things transition, it's 3 sessions. If any of you in your practice want to sign up for those, it is beautifully done. It's fantastic, but it does give a cursory overview of a lot of topics. That's why it's broken into 3 sections. So there's not a huge emphasis on health, but there is a mention of health transition in there, enough to kind of wet their whistle, so families will try to dig in and find more information. And so a lot of this piece that we're looking at, medical transition, is a subset of all things transition, and we can definitely expand upon that with some of the other resources in the community who know about specifically the healthcare transition piece.
So yeah, let me just, I do have a little bit of information about that later on in the slides, but for those who are listening and they're not quite sure what Transition University is, Tina, do you mind trying to explain that and who Amy Hurst is?
Yeah, so the Utah Parent Center a few years ago, I believe Gina was the one who brought that grant in. And it, for years, Family Voices had done most of the transition calls, whether it was guardianship or health transition or whatever. And I think we did a good job, but we did get a grant to, to make transition more, give it more in what we needed to teach. And so originally Jody Hansen, which some of us know, was brought on as that coordinator, and she started to create that program. Amy Hurst was her co-worker and took over when Jody left the Parent Center. And it's a really good program. They have I think they've gone through 1.5 years now or more of teaching these classes that are 3 classes you sign up for. You can only take 1 if you want to, but I encourage the 3 because you learn kind of everything. And it's just a really good class. You can also just have parents call the Parent Center and ask to talk to the transition people if they need one-on-one consultations as well. And these people do take calls. And so, yeah, it's a good program. I think we get a lot of parents signing up for it, and the guardianship piece is always big. I think that's one of the hooks in this transition piece for sure. But again, there we go. Series 1 of 3. So there's three classes. They cover all transition topics. It's really good. I think any parent that has a kid 14 and up could take it and really have a lot of, get a lot out of it. And especially if you know people that haven't even dipped their toes into transition and their kids are 17, please have them contact the Parent Center and at least get some knowledge on what's coming up. Because, just yesterday I had a call and the parent just didn't even know what to do at 17 years old. And I don't know how people slip through the cracks, but I think the more we suggest these things, the less we'll see of that, hopefully. There's a lot of people out there, and so encourage them to learn, because if they don't, it's a rough road if they don't know how to do what they need to do for their kids.
And the next transition series, Transition University series, is actually in November, so November 3rd. Yeah. And I believe that's a Wednesday night. So
I was going to say that any of the practices too, if you are not on the Utah Parent Center kind of listserv, hop on there. The Utah Parent Center offers dozens of absolutely fantastic courses and seminars, webinars, things like that are really useful for families. So, hop on there, get on their listserv so you're getting those notifications about upcoming events that you can, to which you can refer your families.
There we go. Okay. So we'll make sure that that's clear in the summary of the meeting that we send out as well, when the Transition University series will be and how to get involved in it. So, and
I'm going to go and put the direct registration link into the chat, and you can just give that also directly to families, and it just takes them to registration.
Okay, that sounds great. Okay. Oh, I put a lot of text on here. Try not to look at it. The panel about insurance, I thought it was really interesting, and Tina was involved in that, and Pat Rowe was involved in that. And maybe rather than looking at this very dense screen, I'll just see if Tina and Pat want to sort of sum up what was talked about there. Yeah, I thought certainly talking about the appeals and when you get a denial, that was really interesting. Understanding insurance was a big theme, right? You got to understand your insurance.
Yeah, Pat, you want to go or you want me to go? I will start.
Okay. Pat may not be able to talk.
Yeah, so several of us were on this panel. It was Pat, Lou Ann Jones, myself, and Eric, I believe. Eric
Stokes.
Yes, thank you. I'm not getting last names today. And so I thought it was interesting to have, consumers talking about Pat is on the other side and she's really helpful to us consumers. She has been for a long time. But to have some of those consumers talk about our experiences with insurance, and they asked me, Adam's 21 now, we've done a lot of things with insurance over the years. And I've also done things for myself with insurance, and we talked about appeals and how those work and how they may look, and you don't know yet that your provider has actually gotten a denial from your insurance, and they do that appeal first. So we walk through appeals, and I think it's really important to explain to families that, that first appeal from the provider isn't the end all. There's usually a way, there's always a way for a consumer to have their voice heard in an appeal as well. And so a lot of times what will happen with families is, their provider will call and say, we put in a request and we got a denial, so it's been denied. Sometimes they'll offer a second help with the appeal. But as a consumer, you can provide your own appeal and your own letter to insurance to hopefully, make it known that you need this service for one reason or another. The other things they asked about, let me think now, I should have taken some notes. They asked about, changing providers from pediatric to adult. And I had a lot to say about that because we're actually in the process of that right now. And we're also in the process of him being 19 when COVID started. And now he's getting ready to turn 22. That is insane. Well, you need to think about it. And so I kind of call ourselves, COVID transitioners, because he was with all of his pediatric providers at 19, and we were just trying to start transition, and everybody was kind of happy to keep him at 19. Now he's 22, and I've had to say on virtual visits and calls with our providers, we're not willing to leave you yet. And we really need that transition visit where you give us information on transition and you allow us, or you at least help us to find a provider that can serve him as well as you have. And so that's my spiel now with a 22-year-old that hasn't really been able to physically transition yet with all of his providers. Some of them, yes, but that's, as a parent, I feel that we should use our voice there and not just, I have had somebody try to make an appointment in neurology and say, okay, well, he's too old now. So, we could send you a list of other providers. And I said, well, I'd actually like to talk to the neurologist one more time before we leave. I'm hoping that you can provide that for us and that we can actually have a goodbye meeting. I just feel that, somebody that has served him for that many years. I think that's pretty much what I talked about. The other thing was guardianship within guardianship paperwork being put into the files. That's really important. I just can't remember what provider I was talking to the other day, but they wouldn't talk to us because they said you have to get this sent in. And this was after that transition summit, Mindy. And gosh, which one is it? I'm trying to think. I called a couple people this week, but they said, please get this sent in. We need to have it on file. And so basically all he had to do was scan it and send it in to them so that they could make sure they have it on the file and they can talk to us instead of him because he's nonverbal.
Yeah, that's very important. Yeah. Thank you. And one thing that I remember out of that panel is that there was I'm not sure exactly what her role is. Maybe she was kind of office manager at a family practice, but she got up to the microphone and she said, patients don't understand and families don't understand that your doctor does not know what insurance you have. And furthermore, they don't know what that insurance plan covers. And she said it very emphatically. And I think she may have gotten a round of applause from the people who were there in person. It's really important that families understand that they kind of have to be the advocate for themselves and the expert for themselves on what their insurance plan covers. And that's hard. That's really hard. It's confusing and it's tough, and it's one more thing or many more things. But that was definitely a message I heard from that first panel. So, thank you very much, Tina. All right, let's go back to the second panel. Panel 2 was about maintaining mental wellness. And this was a really interesting panel. It turned out, I think, to be as much of a brainstorming session as it did, some sort of a discussion from the panelists. The folks in the audience and online got very involved, lots and lots of suggestions. It was great. And again, educating ourselves or helping our families we work with get educated on how insurance works becomes really important in terms of getting mental health support. And it's tricky when you're working with a young person who's transitioning to adult healthcare with mental health, as I'm sure you guys know, because it's different than other medical conditions that need to be transitioned, and there are more steps. So some of the things that came out of there were trying to get more time with the providers, if at all possible. That would be very helpful. Do that transition readiness assessment annually, just like Stephanie was talking about, and start chipping away. Also having those young people particularly and their families know that you can change mental or behavioral health providers. That is your right. And it may be necessary to get that right fit. And that's hard, but you can and you should if you need to. It was brought up that providers need to be positive and clear in their communication about transition. It's a tough one, but that would be so helpful. And it was really interesting. They had several young people who were part of the panel. Well, 2, I guess, Avery and Aaron were part of the panel. And what they talked about, Aaron in particular, was that transition doesn't necessarily just happen once as well. There are different kinds of transition that could happen for a young person, right? And so you might transition in one regard, whether that's to adult health care, but maybe it's just to a particular kind of adult health care, and then you have to do it again in another way. So I think practices and folks like us who are supporting these families need to be aware that it may not just be one and done either. And then the question was asked, what will help young people be engaged in the transition process? And these particular young people were, I think right around like 20 and 21, not still young, and both had had some mental health issues that they were working through. And it was really interesting. So Aaron said, get me out of class. If you can get me out of class to do some of these things, I'll go. I'll be engaged. And he's been in therapy for a while, and just that process has made it easier for him to talk about himself. So that was really interesting. Talked about if patients, young people, are able to have 3 questions prepared every time they go and see one of these providers they're going to transition to, that can help. Gets them talking, gets them engaged. Clinics, if they are able to use reflective listening and really make sure that families and young people are aware of what the purpose of the visit is. Some of the providers on the panel were saying, we sometimes don't even make sure that everyone in the room knows what's going on. We need to step back. And yeah, just a lot of really interesting, engaging ideas from people. This got people talking quite a bit. It was great. All right, and the last panel, and we'll have to go through this pretty quickly, but as I mentioned before, Tony and Natalie and Eric were on it. And this was really about talking about community partners and ways to find the resources that you need, both in urban settings where they're more available and rural as well. And so it was great to be able to let those people on the meeting know about the ISP group and their contracts with local health departments around the state that provide care coordinators who can be supportive of families with young people transitioning. We got to hear some great personal stories of helping families with transition processes, and Tony told us about helping a Spanish-speaking family in the Ogden area with the process of guardianship for their son who turns 18 in May. So coming right up, and Tony even went with them to the courthouse so that she was able to really witness everything and be that much better prepared for the next time she gets to do this. So she's becoming an expert. And the idea of that Facebook group for families in transition, I thought was really interesting. Tony brought that up. And we got to hear a story and experience of Gwen's. It was a tough story to hear, Gwen. Eric read that out, and it sounds like perhaps she was able to get some help because of Gwen's advocacy for her. And we like to hope that she's doing better now. That was really quite something. And Natalie was talking about really making folks aware of all the resources that are available that people may not understand, including the ISP team, Utah Family Voices, Utah Parent Center, the Transition University Series, the Utah Children's Care Coordination Network, and the Medical Home Portal. And so we were able to highlight UCCCN and the portal during this panel as well. And we're running out of time. This was great, but I want to do a little poll with you if that's all right. So is this good, Eric? Shall we give it a try?
Yeah, let's do it. Just for our own knowledge of all things transition in the state, and particularly for our maternal child health block grant that we apply for and report on every single year, we're hoping to be able to ask this group regularly about things related to care coordination, medical home, and transition. And we thought today was a really great opportunity to ask you folks some of your practices, how your practices handle transition, if you have a policy in place, and just a couple of other questions. So if you would take a minute to answer the poll Mindy's going to put up, please fill these in quickly, and we will report this information at the next meeting. But we're just kind of curious to see what the consensus is amongst our partners in the community on these types of questions.
Are you seeing the poll?
Yes.
Okay, great. I'm seeing some responses come through, so we'll just give a minute.
While we're waiting for those responses to come in, I just want to reiterate that you do have backup in the community to help. So if your office doesn't have a transition policy, please really consider getting one. So talk to your practice managers, your providers in the office, and talk about getting something in place. And please feel free to call in reinforcements to help back you folks up while your office learns about all things transition and how to help your families. Integrated services, we're delighted to help any of, I know Stephanie's son is willing to help, and Utah Parent Center, Utah Family Voices are willing to work with you as well as you work with your families.
And the other thing that we want to endorse and underscore is that although the GOT transition information and plan is pretty comprehensive, it is not something that has to be, you know, bitten off and swallowed all in one bite. If organizations and practices are able to start with even just one or two things, and the GOT transition information is broken down into those steps, so you don't have to feel like you have to, you know, take it all on at once. And again, I think, you know, Stephanie's group and Eric's group would be terrific folks to talk with about how to get started on that in a way that's reasonable for what's going on in your practice. All right, well, things are slowing down, so it may be that we're done. I'm going to leave that poll up until the end, so feel free to continue working on it if you're still in the middle of it. But I'm going to go ahead and take you back to the transition train. So Dr. Giardino told us that he doesn't want us to be on an old locomotive. He wants us to be on the bullet train. So here's the bullet train picture. We're probably not there yet, but we're getting there. And we hope you'll all become transitionologists. And just again, know, as Eric indicated, that there are resources and support. The medical home portal is going to be continuing to add information on transition for clinicians, so that we have a lot for parents and families, but we're adding more for clinicians and medical home teams. And then this project overall will try and keep information specific to what's going on in Utah on the medical home portal as well. All right. Okay, we just want to remind everyone that you can use our listserv in between meetings. This is the way you can contact each other if you need help and you need some more support for a tough case or whatever it may be. And we love it when that happens. And there's such a, you know, welling up of support that happens. It's really cool. So know that you can actually just email right to that address. And again, we'll send this out in the notes. And our next meeting is November 17th. Can you believe it? The holidays are almost upon us. So thank you, everyone. Really appreciate you being here and hope that you have a good rest of your day and your week. It sounds like we have a respite from the rain for a little bit. So take care, everyone. Bye-bye. Let's see. I think I can probably stop recording.